Hello, class. Welcome to Flourish Nursing Academy. This is Tutor Godwin. We are discussing irritable bowel disease. Irritable bowel disease is a common disorder that affects the large intestine, colon. IBS is a disorder characterized by cramping, abdominal pain, bloating, constipation, and diarrhea. Young women, less than 40 years, are commonly affected. Etiology. Exact causes are not known. 3. Psychological factors. Anxiety, depression. 3 altered gastrointestinal motility. 3 altered visceral sensation. Abdominal pain in IBS patients can be reproduced by balloon distension of rectum, colon, or small intestine at volumes which do not cause pain in control subjects, indicating abnormal perception of visceral sensation. R3 luminal infection. About 10 to 20% of patients develop symptoms of IBS following gastroenteritis. Clinical manifestations. Symptoms may range from mild to severe. IBS can start at any age, but is most common in late teenage years or early. 3 abdominal fullness, or 3 loss of mucus from the rectum, or 3 urgency to pass stools. 3 abdominal pain, 3 sense of incomplete evacuation, or 3 gas and bloating. 3 constipation, 3 diarrhea, 3 difficulty passing stool, 3 passing mucus in stools. Diagnostic tests. 3 complete history taking and physical examination. For 3 barium enema. 3 ultrasound. 3 stool examination. 3 upper GL study. 3 colonoscopy. Sigmoidoscopy. Symptom. Diagnostic criterion is depicted below. A. At least 3 months of continuous or recurrent abdominal pain. That is, R3 bears 3 relieved with defecation, and or a 3 associated with a change in the frequency of stool, and or a 3 associated with a change in consistency of stool. B. 2 or more of the following at least on 1/4 of occasions or days. 3 altered stool frequency, greater than 3 bowel movements daily or less than 3 bowel movements weekly. 3 altered stool consistency, lumpy or hard or loose watery stools. 3 altered stool passage, straining, urgency or feelings of incomplete evacuation. 3 passage of mucus. 3 abdominal bloating or distension management. The goal of the treatment is to relieve symptoms. 1. Reassurance and psychological support. 2. Dietary advice. Patients should avoid dairy products, foods, beverages, or medications containing fructose or sorbitol, excessive caffeine, or gas-forming foods such as brown beans, Brussels, cabbage, cauliflower, and onions. High-fiber diets such as ispagula. Husky preparations are most effective in patients with constipation. High-fiber foods are needed to relieve constipation. 3. Patients with diarrhea may benefit from a morning dose, if necessary, 2 or 3 daily doses of an antidiarrheal agent, i.e., loperamide or codeine phosphate. 4. Antispasmodic is commonly prescribed, which help to control colon muscle spasms and reduce abdominal pain, i.e. Spasmonal, Colofac, Buscopan, and peppermint oil. 5. Administering anticholinergic medications, dicyclomine, propanthyline, about a half hour before eating to control the colon muscle spasms. 6. Antidepressants may relieve some symptoms. 7. Controlled clinical trials that have shown benefit with non-absorbable antibiotics, rifaximin 400 mg TDS, and probiotics. Once you've understood these fundamental aspects, managing IBS becomes substantially easier. It's crucial to tailor these strategies to each individual's unique symptoms and triggers. Remember, while managing IBS often involves trial and error, the goal is to reduce symptoms and improve quality of life. A proactive approach, reinforced by a healthcare professional's guidance, is essential. For those interested in more advanced studies, we're offering a comprehensive module on gastrointestinal disorders next semester. We have a little time left, so let's open the floor for questions. Don't hesitate to ask anything that's on your mind. How does stress actually impact IBS? Are there specific relaxation techniques you would recommend? Excellent question. Stress can exacerbate gastrointestinal symptoms. Techniques like mindful meditation, breathing exercises, and yoga can help manage stress levels effectively. Can lifestyle changes alone be sufficient, or is medication always necessary? Lifestyle changes play a significant role in managing IBS. While some patients may rely on medication, others respond well to dietary and lifestyle adjustments alone. It's about finding what works best for you.